I showed you on the slides I gave you when we talked about caring several definitions, some from AACN, some from Watson, right? So I think all of those work, but I think the one that we're particularly going with is the Watson definition.
Okay. What are challenges of caring and providing care that you have witnessed in your career?
Sure.
Challenges in providing caring and nursing, you mean?
Mm-hmm.
Time is a big challenge, right? So if you have 5 minutes on the floor to do something, and it requires you to do a particular task, we find ourselves sometimes in nursing getting very task-oriented. We often forget that there's actually a human being there.
Mm-hmm.
So time is always a big challenge, right? So it's a challenge in the hospital, it's a challenge in home care, it's a challenge everywhere. Other challenges...
No, sorry, switching over.
Oh, other kinds of challenges have to do with, when we've talked about this in class too, the environment, what's going on in the environment, patient's level of pain, so how much they're attending to, I think, whatever your task is, which interferes with what you want to do in terms of task, but of course should not interfere with your caring approaches. Mm-hmm. So I think time is probably the biggest problem, and I think you'll find that when you get into the hospital or into anyone's homes, that time is a big component, but you can still do it. You know, you just have to center yourself on the patient's needs, and remember all of the things we've been talking about in terms of patient-centered care. Right? So in 2 minutes, you can show caring behaviors to a patient.
So going off of that, throughout your career, have you seen that caring has made an impact
on clients?
On clients.
Oh, no doubt about it. So you can treat someone, you can just go in and take their temperature and measure their pulse and their blood pressure and say, have a nice day, and leave, right? Or you can take a few minutes to, try to really make a connection with the patient. So what does that mean? It means the client feels cared about and cared for, feels more like a human being. And have I measured it specifically? No, I can't say that I have measured that the client is able to get out of a hospital quicker, heals faster. But I think okay. There's pretty good evidence in the literature, not just about caring, about empathy and all of the other behaviors associated with nursing that really do make a difference in terms of how a person experiences their situation.